Hi, my name is Dr. Teresa Tacey. I'm a pediatric cardiologist and I specialize in fetal cardiology. I'm the medical director of the Fetal Cardiology Program at Lucile Packard Children's Hospital at Stanford. What inspires me as a fetal cardiologist is really the connections I make with the families. I'm developing relationships that I'll have for many years. The strengths of the fetal cardiology program at Lucile Packard are threefold. Number one, we have a team of people that are highly attuned to providing compassionate, empathic care. We provide almost loving care. The second strength is the fetal cardiology team. We're a team of about 12 people that all work together to get the best care for parents and the most accurate diagnosis. The third aspect of Stanford Fetal Cardiology Program at Packard that leads to the very high quality care that we provide is the subspecialty programs and experts that we have at Lucile Packard. That includes other cardiologists who provide expert care of very rare disease, but because that is their area of expertise, they see a fair amount and they know how to deal with what is very rare disease. We have our cardiac surgeons, anesthesiologists, and neonatologists and perinatologists that all work together to deliver the best care. Typically, a fetal cardiac condition is discovered when there's been either a finding on early screening, such as a 20-week scan, or which is looking at the whole fetus, which most mothers undergo that testing during their pregnancy, or even earlier. There's 14-week scans that are done in the obstetrician's office, looking at markers that could indicate a problem. There can be other reasons too, like if there's some kind of a risk to the mother's pregnancy, for instance, if the mother has diabetes, or if she has an autoimmune condition such as lupus. Those risk factors can and do initiate automatically a more detailed imaging of the heart. There might be also another risk condition that's not a maternal factor, but there might be a history, like a family history of someone else or the mom having heart disease or heart problems as a child. So there's many different paths that can lead a patient to us, but typically they come to us from their obstetrician who has some reason to believe that there is either an increased risk or a suspicion of something wrong in this particular fetus. About 1% of all children have some kind of a cardiac condition that is from birth. So that's a congenital heart, sometimes called defect, sometimes called disease, sometimes just called a problem. The most common cardiac defect is relatively minor. It's a little hole between the two pumping chambers called a ventricular septal defect. And oftentimes it doesn't even need surgery. What we see, though, a lot of as being a tertiary care center is we do see complex and profound heart problems in the fetus. And we can manage that and take care of those parents and manage the delivery as well. So the number one thing I would want mothers to know is that this is not your fault. In most cases, we don't know what causes congenital heart disease. True, there are many genes that have been discovered and that are known to be related to it. There's many more conditions, however, that don't have an understood cause. The only thing that I can say is that there's been some data that shows having good stores of folic acid pre-conception might have an impact in lowering the rate of congenital heart disease. Now, that's not saying, though, once you've been diagnosed, if you start taking folic acid, that's going to repair the heart. The heart is set in its anatomy by about 8 to 10 weeks. Just around the time that you're figuring out that you're pregnant is usually the heart is already, the anatomy is set, and now it's just going to grow in size with the baby. What I generally tell people is just take care of yourself. You get a lot of rest, learn how to acknowledge any stress that you're feeling and learn how to deal with it, because you're going to need to build those reserves. For the majority of cases where a fetus is diagnosed with a heart problem that will need surgery in the first year of life, the most important things to be doing prenatally are to establish a relationship with your care team, and that would include your obstetrical care team and your pediatric cardiologist, who you think will be following the child after birth, planning for the delivery of the baby. So your obstetrician and the fetal cardiologist will work together to discuss, best options for delivery, because the obstetrician is taking care of you and your pregnancy and your labor and delivery, whereas the pediatric cardiologist is taking care of you, but mostly is taking care of making sure that the child is born in the optimum environment to manage their congenital heart situation. In terms of whether early fetal diagnosis improves outcome, that's been an area that's been debated. And there's been some data that suggests there might be some improvement. There might be some improvement in other organ systems, such as even when the heart's impacted, there's been studies that show as well, they had better neurologic outcomes, or they had less renal impairment, less problems with their kidneys after surgery. So there's a possibility that it might improve just because you've done your delivery planning and the baby has been now managed as early as possible in the center that's optimum for that child's care. There's a big spectrum within congenital heart disease, from mild to quite severe. In the mild situation, the child's heart condition might have virtually no impact on their life. Even you might have a mild condition that needs one surgery, one open heart cardiac surgery, which is of course an enormous deal for the child and for the family. But once they go through that surgery, they might need really very intermittent cardiac visits as they grow into adulthood. On the more severe end of the spectrum, we can have cases where we tell the family, and we can tell them all of this prenatally, your child will never have a normal cardiac physiology. It will never function normally because there's just not the pieces of the heart needed for that. We can do surgeries that allow your child to live and potentially thrive, go to school, have friends, ride their tricycles, but they might only have what some people call half a heart. And so those cases might need several surgeries, 3 surgeries by the time they're about 3 years of age, and might also in the future need a heart transplantation. And there are some in the most severe end of the spectrum where we tell the family that we do not even expect their fetus to live to birth. Regardless of where parents are in the diagnosis is in that spectrum, we've seen it, we can help them, we can plan for their care. We're experienced at talking to the family and figuring out what is important to them so that we can find the plan of care that's best suited to them. Typically, anyone with a congenital heart problem will require lifelong care. And the question is, how intense and frequent is that care? So someone with a minor heart problem might need to see a cardiologist after birth, and then they might need a procedure or a surgery in the first year of life. And then if they are pretty much restored back to normal cardiac function and structure by the surgery, then they can go on and might need intermittent cardiac visits. There are more intense or more impactful types of heart problems where the child might need to see their pediatric cardiologist several times a year and might need other testing to be done to monitor things. They might need, more operations. There are so many variations of heart disease that it's why you need a very good relationship with your cardiologist so that you feel comfortable with, whom you feel is communicating well with you, what the plan of care is, when the procedures are going to happen, what kind they're going to be, what you're waiting for to plan for the next procedure if there is one in the future. And care is individualized for each patient. When a mother has been diagnosed as carrying a baby with a congenital heart problem, she might wonder who should be on her care team. The most important thing at that point is her care. So if she is followed by an obstetrician, that obstetrician will be on her care team, will remain on her care team, and will manage her pregnancy, her health, looking for any signs that she or her body is continuing to handle the pregnancy well. And then that obstetrician is also monitoring the fetal well-being in ways like monitoring the fetal growth and fetal heart rate and things like that. A pediatric cardiologist is also on her care team. So that pediatric cardiologist will very intermittently see, in most cases, very intermittently evaluate the baby. So for most congenital heart problems, when we diagnose the heart problem, that's not likely to really evolve or change until after delivery. So we usually see them at diagnosis. We might do some follow-up imaging to clarify some question that we still had about the diagnosis. And then we will see them before delivery, generally around 34 weeks. And the reason for that visit at 34 weeks of pregnancy is to do one last follow-up, one last check, make sure that we understand fully what the fetus's heart condition is and understand fully what we do anticipate for the baby's needs after delivery, and make sure with the obstetrician that we are planning for the best care for that fetus and for the mom for delivery plans so that the baby is at a hospital that provides the appropriate level of care for that child. So some of those questions might be about the surgeon. How do I choose a surgeon? How do I know that I'm at the right hospital for my child's care? It's really important for the fetal cardiologist and the team of the fetal cardiology team to help you understand where those resources are that can help answer those questions. For instance, you might want to know, what's the surgical volume? If there's a cardiac ICU for the child's postoperative care. So some questions might be about survival. What is the survival rate that you would estimate my baby might face? There might be questions about the hospital stay. How long do you anticipate that my child will need to stay in the hospital? So these are all questions that we work with you and can answer. We can also point you to resources online. Conquering Congenital Heart Disease has an excellent tool. It's called a guided questions tool. At Stanford Children's Health, we see approximately 2,700 fetal patients a year. Out of those 2,700 scans, we typically will have around 150 patients who we diagnose with fetal cardiac disease. In cases where the fetus has a problem where it's so subspecialized, we're set to do that at Stanford. We have a very deep well of expertise in the pediatric cardiology program at Stanford, and we can refer parents to people who specialize in connective tissue disorders, hearts that don't pump well, rare problems with the blood vessels that go to their lungs, single ventricle patients. One thing that Stanford Children's Hospital is known for in the country is taking on some of the most high-risk, complex cases, some of which have been turned down by other institutions. We have such a huge team of people, even with that sub-volume of patients, adding that risk, we have excellent outcomes with survival rates overall of over 97%. The fetal cardiology program is committed to providing each and every patient with the most innovative, best type of care that's available in anywhere in the country. Or learning that the child that you're carrying, that you had dreams and hopes for, all those hopes are suddenly changed. Some people feel destroyed when they get the diagnosis of a heart problem, but it doesn't need to be that way. We can help you. Dealing with the shock and the trauma is a process. It takes time and it takes a lot of communication. We want to help you know how to deal with that. We try to find families that have walked the same road as what you'll probably face to help from a place of experience. We've spearheaded a national effort to build a website that's specifically designed for parents who have just received a diagnosis, chdcarecompass.com, who provide another resource for families